Hello, Inua students from First United Methodist Church of Winter Park, Florida. You have many friends here who are very proud of what you're accomplishing with Inua. My name is Dr. Jimmy. Can you say that? Dr. Jimmy. I'm a dentist, and my job is to help people take care of their teeth. And I get to fix their teeth when they need fixing. I can do anything they need. Another one of your Winter Park friends is named Joy. And Joy has arranged for all of you to get a toothbrush and some flossing materials for you and for your siblings. So that's a really nice thing. A lot of people here at church really care about you. After today, you will be the teacher for your brothers and sisters. Do you think you can do that? I know you can. After today, you will be an expert and you will know more about your teeth than anyone in your neighborhood. And helping me today is going to be Bobo the dental monkey. And Bobo is helping me because he's got such great big huge teeth. I don't know what to do with his tongue though. It's kind of in the way of everything. Don't bite me today, Bobo, okay? And Bobo says yes. So we're going to learn a lot about teeth, and I just want to tell you at first, you have different kinds of teeth. The ones that are in the front, on top and the bottom, those are cutting and tearing teeth. So those are the teeth you use when you bite a sandwich or something that's not too hard. You don't want to put a bobby pin between those teeth or hold a nail there or anything like that because you can chip those teeth. They're not made for that. The ones in the back are called molars and bicuspids. And those are the teeth that do all the heavy lifting. Most of your chewing is on those teeth. Are you still with me on this? Good, we'll put Bobo down for a second. Two main things are brushing your teeth and flossing your teeth. From today on, you'll brush 2 times a day, every morning and every night, exactly the way I'm teaching you. And you'll use the little flossers I'm going to show you every morning. You'll do this every single day. Now let's talk about why you need to brush and floss your teeth. It's to keep plaque off your teeth. You brush it off and you floss it off. You may have noticed that some people that you're around have bad breath. That's mostly because their teeth are not being kept clean. And after you brush and floss your teeth, your mouth will taste better to you. And there's a right way to brush and floss. Now, I mentioned to you the thing plaque, P-L-A-Q-U-E. All right, you should know that bacteria, the germs, are normally present in your mouth. It's normal for you to have germs in your mouth, and you can't get rid of them. You can't see them. And what happens is when you eat sugars in your diet or you drink sugary drinks, and there's sugar in almost everything that you eat, those little bacteria create gluey stuff that allows them to stick to your teeth, and that's what plaque is. And plaque bacteria make acid that slowly eats into your teeth, and that hole in your tooth is called a cavity. So bacteria plus sugar equals plaque. Plaque leads to acid that causes cavities and actually gum disease. We'll talk about that too. So when you brush and floss your teeth, you're fighting cavities and you're fighting gum disease. And it's necessary for you to remove that plaque every single day. So Bobo uses a big toothbrush, but that's too big for you. So I'm going to show you the same toothbrush that Joy gave you, and we're going to talk about how to brush your teeth. First of all, you take your toothbrush just like you're shaking hands and you grab hold of it. A lot of people, what they do is they just start brushing and scrubbing and jump from place to place, and so you're missing a lot of what you need to reach. So I'm going to show you that what you want to do is hold the toothbrush, aim it up at the gum line where the pink part meets your tooth. That's the gum line, upper and lower, inside and outside. You're going to hold the toothbrush, aiming it up at the gum line, and then you're just going to go a little rubbing, scrubbing motion like that. That's the motion to use to clean your teeth. Same way down below. All right? So the second thing is you need to get organized. Remember I told you that most people just jump around? You're going to miss more than you reach. So when you're organized, you don't miss anything. So you're going to do this in 3 parts. Number 1, you're going to clean all the outside surfaces of your teeth. That's the side of your teeth next to your cheeks and your lips. That's number 1. Number 2, you're going to brush the inside surfaces. That's the sides of your teeth by the roof of your mouth and by your tongue. That's number 2. And number 3, you're just going to brush off the tops of the teeth. That's the easiest part. So 1, 2, 3. 1 is outside, 2 is inside, and 3 is the tops. And then after you do that, you're also going to stick your tongue out and brush off your tongue. And that's where Bobo needs the big brush because he's got such a huge tongue. So a lot of those plaque bacteria we talk about live on your tongue. So brushing your tongue will make your mouth feel good and you'll have less bacteria to worry about. All right, now getting organized, number 1 was what? Was the outsides, right? So what you're going to do is start and finish in the same place every time. You're going to start on your last teeth, aiming the brush at the gum line, making sure it goes all the way back to the last tooth. And you're going to do the gentle rubbing, scrubbing all the way across till you reach the last tooth on the other side. Then you're going to go down below. Remember, you're still on part 1 at the gum line on your very back tooth, as far back as it goes. You're going to do the rubbing, scrubbing all the way across to this tooth. Now you just finished part number 1. So part number 2, you remember, part number 1 is the outside. Part number 2 is what? It's the inside. So you tip your head back and you get your brush in there and you start cleaning all along the gum line on the inside on top. And then the same way down below, way back in your last tooth at the gum line, aiming it down at the gum all the way across. Now you've done part number 2, and what's left? Part number 3 is the tops of the teeth. All right, and that's easy to just brush the tops of the teeth. And you can brush the tops of the teeth hard. What you don't want to do when you're brushing parts 1 and 2 is you don't want to brush hard. When you have this brush, you don't want to hold it like a hammer and go in there and scrub those teeth because you can actually do damage. You hold it lightly and you just lightly rub and scrub along the gum line the way it was described. That way you don't damage your teeth and you get the teeth clean all the way down to the gum line. That's important. And because you probably have not been doing this, you're going to notice that after you spit out doing this, you're going to see a little bleeding. And healthy gum tissue doesn't bleed. But the good news is after 2 weeks of doing it the Dr. Jimmy way, you're going to find that when you spit out, you have no bleeding. And that means that you're doing a good job of taking care of the teeth. And if you forget to do it for a couple of days, you'll see that they bleed again. So your job is to keep the gums from bleeding and keep the teeth healthy. All right, so we talked about part 1 outside, part 2 inside, and part 3 on top. Well, guess what? We're not done because in between the teeth, the toothbrush does not go in between the teeth. And where the teeth touch together like this, the toothbrush can't clean it, but those sides need to be cleaned as well. So how do you clean those sides? And that's with dental floss. And dental floss typically comes in string form like this. It's string that you put in between the teeth to clean the teeth off. I find it easier to handle if you use little flossers, and I've given you enough so that you have a bunch of the flossers, and they look like this. It's a little stick that's got floss on it, and the end is a little pick you can use like a toothpick. And what you're going to do is, remember, you're cleaning off the insides, the in-between sides of those teeth. So you're going to take this, and you're going to put it between the teeth and push against one side and then pull against the other, starting behind your last tooth and going one tooth at a time, all the way across all the teeth, upper and lower teeth. It'll be a little bit tricky for you to do the upper ones, and if you have a mirror, it helps to look in the mirror and see where you're going. So you want to preserve this as long as you can. Eventually that string will break, but you have this little toothpick on the bottom, so you can go in there and keep food out from between your teeth with the little floss stick. Now remember that you're each going to get a toothbrush, and you'll have a toothbrush for each of your siblings, your brothers and sisters, and you're going to get a box of 50 of those flossers. So between you and your siblings, you want to see how long you can make those last. One other thing I want to tell you about is here in the US, we use toothpaste on our teeth. And you can do that too, but you don't need toothpaste. What you should do is you can do a good job if you know up here how to brush your teeth the way I just described to you. So you can take a little cup of water, you can wet your brush in the water, and then you can go ahead and brush your teeth the way I described to you, then go ahead and kind of clean it with water and go where you can spit out and spit out. You'll be able to clean your teeth just as well without toothpaste. Toothpaste gives you a nice minty taste in your mouth, and it also has fluoride on it, which you don't really need. We in the US don't have fluoride in our water, so we add a little pinch of it. And you've got plenty in your water, so you don't need to have more. Okay, I hope you're still with me. Is everybody awake? I'm glad you're paying attention. And you're smart people because you're in Inua, so you're smart enough to take in all this. And remember, you're going to be the teachers. You're going to teach everybody else how to do the job right. You're the experts now. So now let's learn a little bit about your teeth. Are you ready? Many questions about teeth that need to be answered. How are teeth God's special gift to us? And how do we actually honor God with our teeth? How many teeth do we get to have during our lives? And how long should they last? What are baby teeth? What are permanent teeth? What are wisdom teeth? And are they wise? I don't think so. What is a cavity and what causes it? What is gum disease and how do you prevent it? What causes the dark stains on teeth for people in Naivasha? First of all, by giving us teeth, God has given us a way to be able to eat almost anything we want. Chewing our food makes it easy for our bodies to process and digest our food. Imagine eating a big hunk of meat or corn on the cob without teeth. Imagine that. It doesn't work so well. God expects us to take care of our teeth and try to make them last as long as we live. And we honor God by taking good care of what He has given us. The teeth are part of the body, and all of our body needs to be respected and taken care of. Because it's difficult and expensive for you to go to the dentist in Naivasha, it's super important to keep your teeth clean, and that's called prevention. Did you know that you have two completely different sets of teeth? You have baby teeth and you have adult or permanent teeth. And you might know that sharks have unlimited numbers of teeth. Unlike other animals, we humans are not as lucky. We have two sets of teeth. First, you have baby teeth. You have 20 of those, and they begin to form in your jaws even before you're born. And your first little baby teeth come in several months after you're born, and then by the time you're 3 years old, you have all your baby teeth. Now the permanent teeth, the adult teeth, grow under the baby teeth until they grow enough to push the baby teeth out. And then you have 32 final adult teeth. They start coming in around age 6 and finish up by the time you're a teenager. Each tooth has its own timetable when it's supposed to come in, and this has been designed by God as a special gift to you. When you're a baby or a small child, your jaws and your skull are small. And as you grow from being a child to a young adult, God creates room for all those new big teeth to come in. The baby teeth kind of wear out and the new adult teeth take over. Wisdom teeth are really not wise. Their teeth, normally you have 28, most of your adult teeth by the time you're a teenager. And late as a teenager, your third molars way in the back try to come in. And a lot of us don't have room for those big molars in the back, the big third ones in the back. So they wind up getting stuck in there. And so when you feel pain as a 18 or 20-year-old teenager, way back behind your last tooth, it's probably because your wisdom teeth are trying to come in and don't have enough room and maybe never will have enough room. It's super important for you to clean back there where the gum is, where the tooth has partly come through. And that'll keep you from having pain back there from your wisdom teeth. So wisdom teeth are really not very smart. Now a cavity is a hole in the tooth. Remember I told you that plaque causes acids that eat on the tooth. And those acids eat holes in the teeth. If you look here in the front, in this tooth here, you see a black spot. And that's what a cavity looks like. You may have seen one from yourself or from someone else you know. And that's actually a bacterial infection in your tooth. If that's left go long enough, it goes deep into the tooth where the nerve is, and you wind up with great pain. And then when you go to the dentist, a lot of times that tooth has to be removed. If you come to the dentist in the US, most of the time we can fix that tooth. But again, for you, it's very expensive in Naivasha. So the big thing is we need to prevent you getting cavities. The other thing is that acid causes your gums to be inflamed and red. Have you ever had a sliver in your finger where the skin gets red and it gets sore and puffy? That's kind of what happens to your gums if you don't keep the gums clean. And eventually, the gums will pull away from the teeth, and the bone that's holding the root of the tooth in your mouth will start to pull away, and then your teeth get loose and they come out. You may notice that a lot of older people that live in your neighborhoods are missing some of their teeth. Part of that may have been from cavities, but part of it's also from gum disease. So again, what do we do to prevent cavities, and what do we do to prevent gum disease? We brush and floss. We brush twice a day, and we floss every day, and we don't want to miss. Okay, so you notice, I don't know if you can see this or not, but under your gum, you can see the roots of the teeth. You can see them a little bit. The front teeth just have one root, but the ones in the back that have to do all the heavy lifting, they have 2 or 3 roots sometimes. And those roots are embedded in bone to be solid in your teeth, because when you think about it, you have a lot of biting pressure when you bite into something. And so in order for the teeth to stay there and not get loose, they need to be solid in bone. And gum disease causes your gums to recede, to pull back, and causes your bone to recede as well. So then your teeth get loose and they come out. And that's before you want them to come out. You want them to stay for your entire life. So brushing and flossing. So as I've said over and over again, the best thing you can do for yourself, tooth-wise, is to prevent having problems with your teeth. And it's really up to you to do that. You're the only one that can do it. Sometimes you don't feel like brushing your teeth, but remember some of the things that I'm telling you, and make sure that you get your brothers and sisters to brush their teeth as well, and use their little flossers every single day. So what about fluoride? You know that you've seen so many of your friends, most of your friends probably, that have brown teeth. What happens is, in the US, most of us don't have any fluoride in our water, so we get cavities pretty easily. You have a lot of fluoride in your water, and it's hard for you to get cavities. So what we do is we put just a little pinch of fluoride in our water. We can't taste it, we can't see it, and it makes our teeth hard enough that it makes it difficult to get cavities. And that's a really good thing in the US. In your country, the water that comes from the boreholes has way too much fluoride in it that we really need. And so between the time you're born and the time you become a teenager, when your teeth are developing, if you're drinking fluoride water, and of course you have to drink water, but if you have too much fluoride in your water, that fluoride is built into your teeth and it'll never go away. It makes them brown. So the water at church is filtered. And if your siblings were to get that water or other filtered water between birth and age 10, they would always have white teeth. Now, once your teeth are formed, let's say you have white teeth and you're a teenager, once they're formed and you're drinking the heavy fluoride in your water, you'll have a brown stain that can be removed easily. But if you drink that fluoride water between birth and age 10, while your teeth are developing, they'll always be brown. So fluoride has the benefit of hardening your teeth. It makes them really hard and hard to get cavities. But with all that fluoride in the water, your teeth are so hard that they're brittle. And sometimes those teeth can break or chip more easily than if you didn't have that fluoride in there. So remember what I said about not biting hard things between your front teeth. You don't want to crack into something hard there. That's for soft things or things that just need to cut or tear. No bobby pins, no biting off, little wooden sticks or anything like that with those front teeth. And even the back teeth can get brittle and break apart. So you don't want to bite into pebbles. You don't want to bite into things that are so hard you have to crack into them. Cut up things that are hard and make them into tiny pieces. Chewing ice. If you put an ice cube in your mouth, if you can find ice, and you crack into it, you can crack teeth. I see that in a lot of my adult patients that I take care of here. Their back teeth are cracking because they've cracked ice for many years. I've given you a lot of knowledge today. And again, you're smarter about teeth than anyone in your neighborhood. You know more about teeth than many people in the U.S. know now. And now it's up to you to go ahead and put that knowledge to use. Many of you are the leaders of your families. And this is one of the things you can do as the leader of your family, to teach your siblings how to take care of their teeth so that they don't have dental problems or very few problems. And I will tell you that I want to wish you congratulations. You can use this new knowledge to glorify God and help others. It's been a pleasure speaking to you. I wish I could come to speak to you, but this will have to do for the time being. This is Dr. Jimmy and Bobo, and I'm telling you bye-bye.